Welcome back, everyone, to Chapter 2 of the textbook Public Health Emergencies, where we'll be talking about community preparedness. So FEMA recognizes the need to involve the whole community in the preparedness process so that different points of view are considered. And really, no one knows the needs and strengths of a community better than those who actually live there. And while there's still a lot of work that we need to do on this particular topic, frameworks like this that were developed by FEMA help raise this topic to the forefront and help integrate the community into the process of planning and preparedness much better than before, where preparedness and planning activities previously were really top down and really, pushed down upon the people who lived in different areas, whereas this approach is more grassroots, or at least acknowledging the value of local input into the preparedness work. And these ideas of whole community approach, so looking at the entirety of the community, which means like residents, emergency management practitioners, organizational community leaders, government officials, working together to collectively address preparedness and response issues. This planning approach brings together partners to leverage local resources and build these relationships. All phases of emergency management function really work much smoother when the people involved know and trust each other. Um, During an emergency, everything flows much smoother if people can pick up the phone. You have a general idea of who's on the other end of that line. Talk to someone that you already know, maybe met in a meeting, these type of things where people have better familiarity with who does what in an emergency. And there's a pretty common phrase, at least within emergency management. I've heard this a lot. A lot of emergency managers will say that all emergencies are local. It's pretty makes sense, I guess, in the sense that you think of local responders when something happens, they have to deal with things on your own in the environment where it happens, right down the street, so forth. You may have to deal with things on your own to get a situation resolved before we always try to solve things at the local level before reaching out to state or federal partners or even regional partners, but everything starts at that very local level and moves up. Traditionally, the threats that local health departments in particular, um, the things that we used to deal with are not necessarily everything that we have to deal with now. There's been a continued expansion out of our traditional role, which used to be focused primarily on infectious diseases, sanitation, food safety, those type of things. But now, um, climate change, natural disasters, human-made disasters, these things are happening much more frequently and really involve a more holistic approach that health departments are often seen as the leaders or by default have to lead on these issues. And again, we're just reinforcing some of these themes that we have to understand that every community is unique and has its own level of complexity, with different capabilities and needs that need to be addressed, which is why we need to involve local leaders in this process to build relationships across agencies and across levels of government, This improves a community strength when we're able to handle emergencies on their own, and as well as to know when and who to call for help if the emergency escalates beyond their capabilities. So, crucial steps in the planning process for emergency management purposes is to bring people together to conduct risk assessments and understand what threats are most likely in each community. These assessments can be done from different geographic levels, like state or federal, all the way down to cities and neighborhoods. There's a lot of data resources out there now that help um, emergency planners look at things from different angles and get a very detailed view of what different geographic regions might be affecting or might be affecting them, whether it's looking at different risks like earthquakes obviously would be more likely out here in California than if you're working in Oklahoma or something like that. So we have to look at external and environmental factors like heat and flood risk, but also looking at community vulnerability from a health perspective, like what's the level of comorbidity, diabetes, heart disease, what's that prevalence in those communities that might put them at greater risk from the impacts of a disaster, like we saw in Katrina, Hurricane Katrina, and COVID, where communities had a baseline level of chronic condition that sort of predispose them to poor health outcomes that were exacerbated by these disasters on their own. So, um, and in addition, we talk about continuity of operations plans. This is really thinking about like if you were a business and there was a disaster that happened tomorrow, how would you try to maintain your critical functions of that business, stay open essentially, and accomplish your mission with potentially, staff maybe gone or power may be limited, those type of things that affect your business during a disaster. What do you what do you need to the critical um, services that you need to provide, and how would you get those done um, if you were limited by staff or other resources, stuff like that. So just a way to continue your operations. So when we're talking about capabilities, obviously it's really important for us to do an inventory of different sectors like health, politics, education. What are these civic leaders? What do they have? What do they have available to them to bring to the table, and understand what each sector or partner is able to do. So you would get people together, say, okay, education sector. We end up using the schools, and education resources are often used at central locations for service provision during an emergency, whether it's having the school gymnasium become a shelter or an evacuation site, or even a mass vaccination clinic. We do this quite often where we have schools which are distributed across the geography. There's schools in pretty much every community. How can we use those geographic resources wisely to staff, clinics or something like that during an emergency? So we're really all relying on each other to bring our resources to the table. Emergency planners need to get everybody together and assess what we have available and who can do what, and build those plans accordingly. So it's crucial to build our partnerships across all sectors, from education, health, media, like the press, community-based organizations, those people who are really working on the ground day to day. They can We can tap into these different coalitions to help identify resources and leverage their existing relationships, and particularly the trust that they have built with community members, familiar faces, really help local engagement of community members increases sustainability by making people feel a sense of ownership and control. What happens if somebody from an outside agency comes into your community, sets something up without really everyone participating, and then just leaves? That effort doesn't really last because people in the community haven't really bought into it, and that's what we're really going for is sustainability. So emergency planning in public health requires us to treat others as we would want to be treated, the golden rule. So we need to be able to see things from other perspectives. We have these types of work groups here in California, in Riverside in particular, where we've used them during local emergency planning for COVID and Mpox, monkeypox, if you guys have heard of that, really drawing on the ideas and needs of community members directly, who are directly affected by particular issues. They may be high risk groups for a particular disaster or emergency, and we really need to leverage their lived experience. A lot of people have been through things before, and we need to involve them in emergency planning efforts and public health in general so that we can, better customize how we act when there is an emergency. And many of you have probably heard that phrase before, like, you scratch my back, I'll scratch yours. That's kind of what social capital is. Social capital, in a sense, is a bit of a quid pro quo where um, partners, receive mutual benefits from each other. The example given here is highlights a program where providers were reaching out to each other across these networks, helping build community strength by sharing best practices with each other, which ultimately helps patients get better access to better health care. And with resilience, these are, very key concepts throughout the theme of this course. We're talking about a major theme in emergency preparedness here, the concept of resilience, the ability of a community to withstand, adapt to, and recover from adversity. So I put that image in there, an image of a tree in the wind. I think that's a good example. Trees are an excellent excellent at resilience. They can withstand strong winds by growing deeper roots and by being flexible. They bend and they don't break. Uh, well, sometimes they do, but typically their adaptive response is to be able to, deepen their roots. And if branches break off, they grow newer ones stronger than ever before. So we need to be like that as community members, as communities where we need to use the resources that we have building strong roots uh, through our relationships with each other. Different agencies need to collaborate and build flexibility into their operations and improve their ability to adapt so that they can bounce back after the, metaphorical storm or the real storm. A lot of times we have to um, be resilient, and build that resilience is built before an emergency even happens to help people bounce back from something when it does disrupt the normal daily operations or way of life. So here we go back to our need to build strong communities right now. There are a lot of forces that push people to being more isolated. Disconnection is common. People feeling disconnected, ironically, in an era where um, technology, in theory, in a lot of ways, has brought us, better connectivity. But at the same time, social scientists and a lot of us, in general, have been observing for a while that people are spending less time together, which makes it much more important to reestablish those social bonds. Human beings, we're very social creatures. We need each other, like it or not. We really do. So public health emergencies end up magnifying these issues of isolation, especially like we saw with COVID, where we're trying to limit our exposure to each other, but that has a big impact on all these other dominoes, whether it's educational attainment. We saw those images during pandemic where people were just trying to visit their loved ones in skilled nursing facilities, nursing homes, and having to talk to each other through glass barriers, and those type of things are major issues during an emergency. People are needing that connectivity more than ever, and a lot of people now are talking about loneliness and social isolation as the new public health pandemic. So it's something we have to address as a society. Public health has to continue to be responsive to these changing social dynamics. We have more diverse communities than ever, I think, facing new public health threats that we never faced before, due to the changing nature of our environment, and especially where we have more people than ever living in difficult environmental conditions, near rising waters, floods, heat waves. Um, we have more people exposed to those issues, and we have to deal with that as emergency planners. And this is talking about some of the impacts of our economic situation right now. Our economy, especially here in the United States, has dramatically changed away from moved away from manufacturing towards more of information economy, information services, which has really amplified the disparities. A lot of people in the workforce are being left out, and that results in sort of a power vacuum where major sections of our society are being left behind. It's what we're referring to here as advanced marginality, which is magnifying the inequalities that a lot of people are being left out of economic empowerment, and opportunities to improve their way of life, while others in different sectors of the economy are surging kind of ahead. So this is back to the theme of how the internet has brought people together in new ways, creating communities that never existed before, combining people from across the world, great distances, under bringing them together under a unified ideology, which can lead to massive spread of misinformation. This can make it very hard to establish cohesion and during daily living in general, but also even more in a disaster where people are separating themselves along different beliefs in these communities online, which has its big challenges for us to address. And this again just reinforcing the dramatic change in how society has been uh, evolved by the internet and how we get information, how we interact with each other. Um, that has a big impact on how we message and what types of information channels are going to be effective during an emergency. A lot of the coalition building that we've talked about is definitely easier said than done. You know, we talk about these different ideas, but in practice, they can be very challenging, bringing people together from diverse backgrounds where we have to manage expectations and set priorities. People may see things very differently and want different things out of planning efforts and, you know, just in general for their public health. Um, Society is more fluid than ever as well. You know, we have people moving much more frequently from town to town. You know, we saw these like mass migrations during uh, pandemic recently as well, where a lot of people fled the cities to live in the country, and job to job. Job transfers are easier than I guess easier than ever right now. So it's hard to maintain cohesion in some of these efforts. You know, it's not like maybe how it used to be where people lived in the same place, everybody knew each other, all the neighbors, you know, knew each other, and it was easier in a way to establish a sense of community and work towards a common goal. Whereas now our work is a little bit more challenging because we have to have, you know, uh, acknowledge that people are moving around a lot, and it's more difficult to make those relationships last. So this really, you know, this work really requires dedication and a faith that this the benefits of the work will pay off. So really, so this work, you know, it takes commitment and time to build these relationships and really understand the different needs of these communities that we live in. So, you know, the difference between my where I live and you know where somebody else lives, we have to take that time to understand that we have different experiences and different priorities potentially. And one of the issues we often deal with is that people with connections, you know, we have to break down this cycle where people in the know who have they know the right people, they get access to the right tools and opportunities and information that others may not have. So it's a big issue with emergency planning is making sure that our messages about what to do in an emergency, particularly, you know, we all get these alerts on our phones if you sign up for particular notifications to try. That's one thing we're doing to try to, you know, set up these automated systems to make sure that people have access to the latest information about where they need to go and what they need to do. But even then, getting access to, you know, a cell phone that can provide that information. Some people have never heard about this service, so you know there's always issues to break down um, when we trying to get the information equitably distributed to make sure that nobody's left behind. So wrapping it up here, there's you know there's a lot of great information in this textbook. There's a lot of practical examples, case studies in the book that are relevant here to helping navigate some of these issues. But I'm I'm excited as well to hear from you all about your experiences as we go through this class, to help us with this difficult responsibility that's on us as public health professionals, to help really focus on equitable ways to build communities to help do this work. It's slow and challenging work that doesn't always have an immediate payoff that you can visualize right away, but building these coalitions and partnerships that really give us a reward in the long run. Public health is not for people who want really immediate results. So a lot of this takes time and a lot of work, and using the diversity within our communities as strength and really relying on each other to do this work. So that's it for this lesson. We'll see you in chapter 3.